And I am now 3 weeks post top surgery. So I had surgery on December 14 with Dr. Garamoni in South Florida, and it's been a very interesting experience. The first week after surgery, I was basically in bed most of the time, taking my medication and just following post-op care instructions from Dr. G. I have to say though that the compression garment in that first week was unbelievably stressful. I was so excited to go to post-op care, my post-op care appointment 1 week later to remove the binder. I was as excited to remove the binder as I was to see my chest for the first time, and I was just very excited to have the binder off. After the first week though, I realized that there's a lot of emotional, physical, and mental stress that you experience in top after top surgery that sometimes you don't really think of. You think that after you have top surgery, you know, a weight is just lifted off your shoulders miraculously, and you feel instantly connected to yourself. But I recognize though that I still struggle a little bit with just thinking about healing and what it means for my body, and like a little bit worried about what my scars may look like or if my nipples are healing fine. As dealing with not having mobility, not being able to like get up out of bed on your own, needing assistance with showering. So it's a lot that you have to consider. You don't really have much of an appetite, and it's just something that you realize that you have to process through. But overall, after I saw my chest for the first time, I felt very good. Pause. Your facial. So after surgery, I just realized that was battling with a few things, right? I wasn't sure what my chest would look like. I wasn't sure what my scars would look like. I wasn't sure if my nipple was healing because you can't see anything. You're bandaged down, bound, and unable to see what's happening with your body while feeling tired all the time, a little in pain, and the pain levels go and come. You know, you're on medication, so you're not really feeling the full amount of pain that your body is experiencing, but your body just went through significant trauma. You know, surgery is a big deal, and sometimes we don't give ourselves enough time to think about how it affects us mentally, physically, and emotionally. But one thing I did try to do was to get some exercise, walk around a little bit. I really follow the instructions of Dr. G. Critical too though is having somebody who you really trust to support you, because you kind of like going, you know, you might have read a lot prior to surgery about what to expect, but until you actually have surgery, you really don't know what's going to happen. You don't know if you'll feel nauseous, you don't know if you'll have an appetite, you don't know if you'll be able to, you know, go to the bathroom, you know. And so there's a lot of things you have to really process and think about, and having somebody who is there with you, who you can trust throughout the process, really helps. And so I really appreciate having my partner there with me throughout my surgery, and helping me to cure, that's her thumb right there, caring for me while I healed, and just knowing that I had that person with me that I could just not worry about things, and you know, somebody who can give you medication, and it's okay if you're really not feeling up to, you know, like feeding yourself, you know, or like just doing things that, you know, just being okay to just sit in bed and watch your favorite show. So these things are critical. Now regarding healing, I had my scar tape removed about 18 days after surgery. It's expected that you remove it, it falls off, they say, after 2 weeks, but mine was really not going to fall off. So what I did in the shower was to soak it a little bit with water, just wet it here, and let the water kind of moisturize and moisten the scar tape so that eventually it will be easier to take off. Also, my nipple, my bandages over my nipple, that also was a little bit stressful because removing the tape, don't know if you can see, but the ear is a little bit red, it's a little bit inflamed, and that's because every single day you had to take off these bandages, and and it's adhered to your skin. I didn't know that band-aids stuck to your skin so well. So a suggestion my lovely partner gives me was to go in the shower and just wet allow the water to cascade on the bandages and then take your time and peel them off. So that was a really good session that really helped. And I did that also while having my back to the shower, because you're not supposed to have water hit your nipple, because the first 2 weeks of your nipple graft is critical to the success of your nipple. Now, big reveal. When I removed the scar tape and saw my scars for the first time, I was relieved. Like, don't want to have a lot of scarring, because for me, I think that it's still a little bit triggering, if you're out in public spaces and people are going to ask you questions about what are those scars about, and I don't always want to have to explain myself. No, I'm totally fine with trans visibility and my scars as a representation of my trans identity, but at the same time I want to be able to control when I share that intimate information about my own experience. So limited scarring is a positive outcome for me personally. So I am using ScarGuard to treat my scars every single day. I apply ScarGuard, and I still have so my nipple is not fully healed, as you can see. It's going pretty good, but I still do have to apply the treatment ointments to my nipple and continue to monitor. Still sleeping on my back. I'm not really hardly turn. I'm okay with that for the most part, but I'm really looking forward to at least being able to sleep on my side soon. So that's pretty much what's up right now. 3 weeks post top surgery. I'm feeling really good. There's still some swelling, I think, but I have pecs, so I like that. So no gym, but that's just how things are. Oh, and I forgot to mention, in terms of raising my hands, I can go like this about. I'm not really pushing it. Again, I'm giving my body the maximum opportunity to heal and to get better. So I'm really very mindful of the instructions given by my surgeon. So my hands are raised to like about this, and I'm okay with that. My scars are healing very nicely. My drain holes are pretty much closed up, so scarring wise things are going good. I'm very excited and very happy with Dr. G's, and ScarGuard is a definite must. I think it's really good, and I'm looking forward to seeing how my scars progress in the next few months. So that's all for now. We'll touch base again soon.